Welcome back. This morning we're going to talk about a very common condition. Believe it or not, an estimated 35 million adults in the United States have experienced depression at some point in their lives. But finding an effective treatment for depression is sometimes very difficult. In fact, there are many different therapies used to treat depression. Here to talk about those options is Christine Gorgas, the operation manager for the Gulf Coast Clinical Research Center. Good morning.
Good morning.
So we've been talking a lot in the commercial break, and I think the interesting thing is, again, how common depression is.
Yes.
I know we're going to talk about the symptoms, but I think a lot of people are dealing with this and sometimes maybe don't give it the time when they're going to treat it that's maybe
Correct.
necessary.
Correct. A lot of times with patients, they are starting to get a little bit better at understanding the symptoms of depression, reaching out for help, talking to their physicians. Their physicians will prescribe a medication, but unfortunately the conversation stops there. And that's really where the conversation needs to start and
Really
continue.
Really
amp up. Patients will receive prescriptions, they'll start taking the medications, and they won't give the medications an adequate trial with either the dose or the duration. What typically happens is all the medications that are available by prescription, either in trade or generic formulation, are effective. They've been proven effective in clinical research trials, such as the trials we do at Gulf Coast Clinical Research. The problem becomes the patients are not given the information that they need about what is a proper dose and what is a proper duration for a medication. Really, you can't evaluate a medication's effectiveness unless you've given it a 6-week trial.
So 6 weeks is kind of the magic number.
6 weeks is the magic number. As we were talking on the break, these symptoms didn't come overnight. They're not going to dissipate overnight. But unfortunately, patients will take a couple doses of the medication, they won't like it, they don't feel an immediate response, and they'll give up on the medications. And that's so frustrating for a patient after they've gone through all of this, they've made the decision to get treatment, they've tried the medication, and they get very frustrated that they don't feel the full effect of it.
Well, and you were telling me that, I mean, there is a lot of different options, a lot of different drugs on the market.
Yes.
And there's certainly not a one-size-fits-all. I mean, it really does need to be tailored between what you're actually taking and the dosage that you're taking. So
one drug may work wonderfully for one patient at a lower dose. Another patient may have some symptom relief but not full symptom relief. So it isn't a one-size-fits-all. It really needs to be a conversation with your physician. I've tried the medication for a couple of weeks. These are the side effects I'm feeling. These are the symptoms I'm still feeling. What can be done here? And a lot of medications have several different doses that are available by prescription. A lot of physicians will be conservative, start patients at a lower dose that we consider to be a subtherapeutic dose. It's not really the dose the patient should be on to maintain.
But I can understand why they're not wanting to give them too much at first.
Absolutely. It's really to help with the side effects that patients will first experience when they start taking the drug. The problem becomes that conversation stops. Patients never go back to their physician to tell them they're still feeling these symptoms, and the dose is never increased to what is a therapeutic dose.
So let's say you have been on a particular drug for the 6 weeks, you've given it the trial, and you're still not quite happy with it.
Right.
There are some other options, because I think some people would get extremely frustrated then if they've given it the full 6 weeks. And
Absolutely. And again, there are several different options if you have given it that trial and you're still feeling some of those residual symptoms of depression. The first option has been classically to your physician to switch to another antidepressant. And unfortunately, some patients will get in this cycle where the medication will be changed over and over and over again. What we're looking at these days, and the new train of thought, is using other medications in conjunction with the antidepressant to help with some residual symptoms that you're still experiencing. So the medications that you're taking, the antidepressant may be helping with 50% of your symptoms, maybe helping with your sleep, but you're still having concentration issues, you're still having fatigue. There are other medications that can be added in conjunction with your antidepressant to kind of help with those residual symptoms that you're still feeling. And those are some of the trials that we're actually conducting now at Gulf Coast Clinical Research. Adjunctive treatment trials for patients who have been on an antidepressant or were on an antidepressant. They didn't feel it was working for them optimally, and they want to try something else to really try and experience that full symptom relief.
Yeah. Let's talk about real quickly the symptoms of depression,
Yes.
kind of starting from square one. If people are, if someone's at home saying, you know what, I'm ready to do something about it. I need to know if I have an issue. What are some of the common ones that you think people should remember? And
we always go through with the symptoms of depression. It always starts with two gateway symptoms that we call them, that feeling of sadness and that issue with lack of motivation, the lack of motivation to be with friends and family. You tend to isolate yourself. You don't really see the point. Then there's also those symptoms of the issues with concentration, the issues with energy, sleep, changes in your appetite, and of course those thoughts of suicide that can be common with patients. And we've talked extensively about sometimes they're as active as I really do want to die, and sometimes it's passive as I'm just weary of life. I wouldn't mind just falling asleep and not waking up. But all of these things are symptoms, and you really need to understand those symptoms. Really evaluate for yourself when you're taking a medication. Which symptoms is this medication helping? Which symptoms am I still experiencing? And then be able to vocalize that to a physician.
Well, and real quickly before we run out of time, because I was asking you, do people go to their general practitioner? I mean, who is it that they should be talking with? And you said, which I think is key, whoever you feel comfortable talking with. So whether it's your OBGYN for women.
Right. And we have found that a large proportion of women actually do receive their antidepressants from their OBGYN because that's who they felt comfortable talking to and opening up to. It's not just a psychiatrist that can prescribe these medications. Medical doctors across the board, your general physician can prescribe them, but really find the person that you're comfortable talking to about these symptoms. Educate yourself. There's so many tools on the website. There are tools on our website at gulfcoastclinicalresearch.com to help you understand what the symptoms are, how the medications affect these symptoms, and what you can do if you're not feeling full symptom relief. Don't give up.
So as we close, I think that's the take home. Make sure you're talking about it, be open about it, don't be embarrassed about it. It's okay, it's extremely common. And then two, don't give up. Make sure you're doing the right 6-week, giving it enough time. As you said, these feelings don't happen overnight. They're not going to go away overnight. And there's options. I think there's hope at the end of the day.
Absolutely. And we're always here at Gulf Coast Clinical Research to tell you what the options are. If you're not interested in participating in a trial, we can still talk to you about what you're feeling, what your symptoms are, talk to you about whether or not it's an adequate dose, give you some information to take back to your physician to help facilitate that conversation as well.
Christine, thank you for being here this morning. I hope to help some people out there watching.
You're welcome.
Thank you, Christine. Let's send it over to Stephanie.